Everyone at Ontario Shores has been rising up to ensure the delivery of quality mental health care throughout the COVID-19 pandemic. Through Rising Up conversations, we are proud to shine a light on individuals, teams, and disciplines who continue to go above and beyond to care for our patients and each other during these challenging times.
Welcome to Rising Up Conversations. My name is Daryl Mathers. I'm with the Communications Department here at Ontario Shores. And for this conversation, we are physically distant and wearing masks and taking precautions during the COVID-19 pandemic. But we are going to shine a light on some of the wonderful things that our staff have been doing throughout the last year plus as we limit the spread of COVID-19 and deal with this new reality. And I'm pleased to welcome from our environmental services group and more, Petrina Abersek, welcome. And we want to talk a bit about your portfolio and the group of people that you work with. So you can tell us maybe before the pandemic, what does EVS on Ontario Shores mean?
Okay. For environmental services, it is an umbrella of different departments. We do housekeeping, transportation internal and external, and switchboard. Our job duties would classify us as housekeepers to clean and disinfect the area. Internal transportation delivers goods throughout the hospital that the patients and departments would require. External transportation delivers products to our satellite locations and also takes patients to excursions, appointments, or events and stuff like that. Switchboard, as you all know, when you talk to our switchboard operator, directs you to the appropriate location that you need to speak to.
So when we talk about the start of the pandemic, how has it impacted our people in EVS?
In EVS as a full umbrella, we've had to alter our duties right from the beginning, almost daily sometimes. We've slowed down a little bit in the second wave, but we've had to reanalyze some of the duties that we had to put together. Paying more attention to high-touch surfaces, cleaning within the units, but then also in public spaces areas. We've had to on hoc create duties for the visitation cleaning, stairwell cleaning, items that affect the patient care that we do on a daily basis. Our transportation staff has had to completely alter their area to work with the restrictions that we have with the pandemic. They have been not allowed to go onto certain units because of cohorting of staff. So they've had to be more communicative to the unit staff members and also to the office so that we can all communicate together. Our switchboard operators have taken on a big role of making sure that when the stresses of people that call in, they are there to be able to direct them to the right location and to do that in a calming way.
Sounds like a lot of changes, maybe a lot of things that you wouldn't necessarily think of when you start your career at Ontario Shores in those areas. Like I know wearing full PPE and certain areas of the hospital, big change. Is there an example or two that you can think of specifically where staff in EVS have gone above and beyond, like either to keep an area safe or to work with staff or patients on a particular issue?
Yes, we've had quite a lot of changes to affect our staff. Our geriatric unit, housekeeping staff, are cohorted to that unit, meaning that no other staff member can come onto that unit to deliver goods to them, to check on their goods, to do a linen inventory, to do at the beginning the floor machines and stuff like that. So the housekeepers on that unit were taking on a large amount of work because we needed to keep that vulnerable population protected. Our external transportation driver has gone to many satellite locations delivering important PPE and food supplies to them. And he has done that in the middle of a snowstorm, on sunny weather, whatever comes his way, he has to deliver those goods to them. Different situations that have happened Gosh, there's so many. PGU, we had an EVS staff member that was a fantastic painter, and she went to the clinical manager on that unit and said, could we start a painting project for the priests that were there? They had a little painting project that they had going, and it was one of the highlights of the priests that were there. One of the interesting things that came from that is that she actually created a painting on how she felt when she was in PGU. And it is hanging right now in the conference place. And if you look at it, it's a very dark picture and stormy waters, but you'll notice then in the perimeter of the picture that there's these life preservers, and it's being sent out to the center where there's turmoil and stuff. And that's how she felt that she was a part of the saving in a turmoiled time. We have, oh gosh, there's so many. The admitting unit, we've had staff in full PPE from the time they step onto the unit to the time that they leave. We've doubled up staff to be able to give them some relief. They were literally in their PPE for a full 7-hour shift other than within their break times. One of the things that they did and that we heard a lot from the clinical staff there is that they were able to spend some time with patients and just talking about their day. Anything from the food they like, the weather that was going on, their favorite music, just to get the patient's mind off of what's going on, being restricted to their rooms and the washrooms. And seeing all of these people in full PPE, face shields, gowns, gloves, masks, it can be a little scary for some people. So just hearing those heartwarming stories where EVS members took time out of their day to help with patient anxiety just by having a simple conversation was amazing to hear.
I don't think there'll be too much trouble pointing out points of pride during this time, but again, as you talk about all the things that EVS has contributed to and rising up, for our patients and colleagues, during this time, is there a way to describe the pride that you feel about this group of people and what they've done?
Definitely. When we had the facility-wide volunteer call-out for internal and external units that may require COVID precautions on it, we had countless people that came in and signed up for it, which was great because we were able to fulfill our TU, PGU, and any external areas that we required to fill with ease. But one of the things that made me most proud of the department is when people would come to me after and say, I can't sign up for the COVID unit for various reasons, whatever they had in their life, but how do I support my staff? My fellow coworkers that are in there, pretty much in the trenches is what they would say, how do I support them? To see the camaraderie that came because of the pandemic, to see just the unity that they all bound together. They come in, I get to see them in the morning, and so sometimes you'll see them dragging their feet. We have a quick little joke or whatever, and it just builds their spirits. They're gone off for their day, and you can see them coming back, and you can see they've had a hard day. You can see the sweat on them, but they still have a go-getter. Let's get this done. We are resilient. Yeah, we're tired. We're really tired is what we hear a lot. But that they come in and day out, and that they have the attitude of, let's get this done. This is what's on our plate. It's not going to currently change. Let's get it done. And just how resilient they are on being a unit. And they are a unit. They are not individuals, though we all are individuals in our own right, but they do bound together and make a cohesive unit of helpers.
Nobody knows your team like your team does, like you do and other members, but what would you like, whether it's the community or people in Ontario Shores outside of EVS, to know about the work that you and your team do?
Our team are pretty much the unsung heroes in my point of view. You don't often see them sometimes. in the forefront of what jobs they need to do, but the jobs that they do are very important. The supplies that you get on a daily basis are brought to you by our dedicated staff. To make sure that you don't bring COVID into the hospital or out of the hospital is because our housekeeping staff are diligent in making sure that their most frequent high-touch surface areas are disinfected. We have the dedication that our staff bring to the facility should really be highlighted, because we highlight a lot of high-profile people, but what really keeps the engine going is all the small parts. And not saying that they're small, they are major parts that are working, and if those parts stop, the major players can't play. So that's what I want, I guess, the facility and I guess in general public to know, is that these are major players that are keeping you all safe, and they have the heart and the drive to make sure that you are cared for on a daily basis.
That's great. Thank you very much for sharing your experiences and letting us know a little bit more about the impact on EVS during the pandemic. Thank you.